Dr. Claytor here. When I talk about a recent journal article that just came out in the Aesthetic Surgery Journal, my very good friends Louis Macias and Dr. Chopra, as well as Tyler Saffron, were authors on this, and it was Aesthetic Submandibular Gland Resection, a review of complications, incidence, and prevention. Why is this so important? Well, when we are in surgery and we are addressing the gland, we make this approach to this area up underneath the jaw. This is what it looks like. We'll put in a little retractor to pull back and get access to the submandibular gland so that we can address it and determine whether or not we need to shave any portion of it. Here's a live video. There's that retractor, and we're looking down at the gland. Here's the patient's chin. And so what we're doing is we're lifting and mobilizing and using cautery to deliver heat energy to cauterize and prevent any kind of bleeding. And you can see we're starting to remove the portion of the gland that is extending down below the angle of the mandible. Here we can see removing this small portion of the gland being brought out and delivered, and that's the amount of gland that's been removed from this particular patient. Injecting local numbing medication into this area, as well as Botox, can be very helpful at minimizing discomfort, as well as preventing leakage from this gland afterwards. So we can see cauterizing this and removing this portion of the gland is highly technical and very delicate work. You can see the blood vessels right here in blue running right along the gland. Here I am injecting with more numbing medication as well as Botox to decrease any activation of the gland. Here you can see the artery and the vein running right alongside of the gland, which is why this procedure is so incredibly technically challenging, and being proficient in this area is so incredibly important. Here you can see this is the artery and this is the vein running right along the backside of the gland. And again, right there is the blood vessel that is being delicately separated away from the gland. That vessel is probably about 4 to 5 millimeters in diameter and represents a significant branch of the facial artery coming up from the deep neck into the face. This represents one of the technical challenges with removing a submandibular gland, requiring excellent hemostasis, excellent retraction, and a lot of experience. Thanks so much.